Thank you. My name is Donald Palmisano, and I'm the Executive Director for the Medical Association of Georgia. I want to first thank Mr. Alan Jansen for reaching out to us and asking the Medical Association of Georgia to be a part of this event. I also want to thank Dr. Gulshan Harji, a longtime MAG member and active Rotarian, for all the work that she's done with us, but also with Rotary. More importantly, I want to thank all Rotarians for all the work that you've done in eradicating polio across the world. I want to thank you for that and the importance that you place on vaccinations. A little bit about the Medical Association of Georgia. We are a volunteer physician organization with over 8,400 members. We are the state organization that represents physicians and patients, and we are most known for our work down at the Georgia General Assembly, but also with the governor's office and with the different administrative offices. It is my pleasure today to introduce Dr. Patrice Harris, who is the 174th president of the American Medical Association. Dr. Harris currently is the immediate past president of the AMA. She is a Georgia psychiatrist that has always advocated for her patients. And that's how I've gotten to know Dr. Harris over the last 14 years. When I first came on to MAG, Dr. Harris was one of the first people that I met. She was known pretty frequently down at the Capitol. She was always down there advocating on psychiatric issues, but more importantly, issues that were much broader for the whole profession as well as her patients. Her experience includes being a private practice physician, but also working as a county public health director and also a medical society lobbyist throughout the years. Before opioids really became the center of attention for this nation, Dr. Harris had worked long and hard on opioids, eventually being appointed as the chair of the American Medical Association Opioid Task Force. She has spearheaded that discussion. She has talked about barriers to care. Also, how do we get more access for patients? And so with Dr. Harris, patients are always the first thing on her mind in all of her advocacy. While Dr. Harris is from West Virginia, and while she was educated through her college years at West Virginia, we do recognize that she went to Emory School of Medicine and graduated from there. So that's why we say that Dr. Harris is a Georgia physician. She has spent her entire career in Georgia, and it is my pleasure to introduce my friend, Dr. Patrice Harris.
Well, good day, everyone. It is certainly my pleasure to be with you today, and I thank my friend and colleague, Donald Palmisano. He has certainly been a great friend and colleague in the many battles that we have fought over the years to make sure that patients get the best care possible. Certainly, it is also my pleasure to speak before the Rotary Club of Emory-Clifton. This is my third time in front of Rotarians. There's a long-standing connection between Rotarians and the American Medical Association in that every year the president travels to Jacksonville for several days of meetings, but one of those meetings is always before the Jacksonville Rotary. And of course, that is because the former president, the AMA, is very engaged in Jacksonville Rotary. So I am very pleased to be before you again this morning. And certainly I will say this is a time of learning and innovation, and technology supports us, but sometimes fails us. But I actually have been thinking about the importance of those experiences, those challenges, and the learning moments for future thinking on the road ahead. So this morning, I will speak to you about some of the ways COVID-19 is currently affecting the U.S. healthcare system and other systems worldwide, and how and why those effects will continue to be felt in the future. Next slide. I have nothing to disclose to you this morning. Next slide. And so what we want to do is make sure that at the conclusion of this presentation, you can name some of the work and the trends that are affecting the U.S. healthcare system, that you can name 3 factors resulting from COVID-19 that could influence the delivery of healthcare, and last, and list some of those factors that have the potential to change both the US and global healthcare. Next slide. So this slide is about me, but Donald has given you all that you need to know about me, but I keep this slide in this deck because I want you at this moment to think about you. So put your face, think about your face in this slide. There is a lot going on. I've been chatting with some of your fellow Rotarians this morning. All of us are working very hard and our routines are disrupted. It's just more difficult for all of us. Those of you who are parents, I know you are trying to blend parenting. Some of you who have the privilege to work from home are doing that. Some of you are having to be out as a member of the essential workforce. So this is my reminder to tell each of you to take time out, to take care of yourself. You know, we hear it all the time, at least we used to when we travel on planes. Put your mask on first before helping others. And that is what we need to continue to remind ourselves to do as we get through this pandemic. Next slide. I also want to make sure that I thank you for all of your work to eradicate polio. You know, I think for generations, there is a tendency to forget and not appreciate the life before polio vaccines, particularly here in the United States. And so we have to always remain hypervigilant. And I think COVID-19, at least I hope COVID-19 has elevated the need for us to remain hypervigilant around infectious diseases. We can never take infectious diseases for granted. And even though in the US we may be ahead, an infection anywhere, we are a global civilization and certainly can impact us here in the US. And I was reading a little bit about the development of the polio vaccine, and pre-vaccine summers were a great time for children to be out of school, but summers were also the polio season. And so I think it's always good for us to go back and think about life before these vaccines and educate those who were not alive at that time of the importance of having vaccines in this country. At the American Medical Association, we support you wholeheartedly in this work. We strongly support preventing childhood disease through immunization. And we also favor using our position at the AMA in international health organizations to promote appropriate immunization programs for children, really all of us throughout the world. In fact, the AMA support of widespread use of vaccines dates back to the development of the Sabin oral vaccine to combat polio in the early 60s. And now, as the entire world awaits development of a safe, effective vaccine, in this case, COVID, our experience with polio, our global experience, that's an all of world experience, shows us the importance of and the effectiveness of working together. Next slide. So truly, this is an all hands on deck moment. If ever there was an all hands on deck moment, this is it. And though the COVID-19 epidemic, or of course that's the disease, is complex, and we don't know all that we will eventually know, we certainly know more than we used to know about this disease. And so we should focus on that, focus on what we do know, focus on what we do know works to mitigate the spread: wearing masks, washing our hands, physical distancing. These facts are rooted in solid evidence. Now, it's encouraging to see political leaders on both sides urging people to wear masks while in public and to practice safe social distancing. We know that that is not universal. And so to build the momentum, the AMA launched a national campaign this summer online and through social media that encourages everyone everywhere to mask up. And the campaign is #MaskUp. to protect ourselves and those around us until a safe vaccine can be developed. And by the way, when we get a safe vaccine, we still will need to mask up and wash our hands and make sure we are watching our distances. This is not about a one-size-fits-all magic wand solution. It's about layers of protection, and we will continue to need to mask up for some time. Next slide, please. So I've been often asked, as I've been on my journey to leadership, what are the great characteristics of a good leader? And there are many, but here's one, something I know for sure. Leaders need to be trusted to tell the truth. If any of you have been on social media today, yesterday, last week, whether in the US or anywhere in the world, you understand that we are all fighting against misinformation and falsehoods. And that's even more acute as we are fighting a deadly infectious disease. The stakes are very high. We must ensure that policy decisions are driven by facts and evidence and not ideology and politics. Early in this pandemic, I made a national appeal for science in defeating this disease, explaining why physicians and scientists, public health officials rely on facts and evidence in carrying out our work, but also reminding the public of its responsibility, social media companies, media companies, of the responsibility to help turn the tide against COVID-19. You know, all of us need to trust that our institutions are keeping science at the fore of their decision-making, and that's why the AMA continues to call on elected officials and major institutions to affirm science and evidence in their words, but not only their words, in their actions as we address this pandemic, actually any public health crisis. Next slide. The AMA, which represents physicians across this country, has responded to COVID-19 in so many ways. First, as I alluded to earlier, we want to make sure we provide trusted, evidence-based resources and clear guidance to physicians. Resources which can be accessed for free on AMA's website for anyone who needs them. We are helping physicians and practices continue to offer the best care to patients. That means being able to recover from the disruption of the pandemic. We've certainly advocated for loans and other forms of financial assistance for practices. And we also have been providing guidelines on how to safely reopen. And let me say this, I may say this a little easier. I want everyone to know that physician practices are working hard to make sure that they are mitigating all of the risk that are within their power. And so I urge everyone, we did go through this period where we needed to shelter in place, but we don't want you to neglect your physical needs. We want you to go in and get your high blood pressure checked if you need to. We want you to go in for your cancer screening tests, colonoscopies, your mammograms. So please know, and if you are having a medical emergency, please don't be afraid to go in and get the care that you need. We have also been pushing at the highest levels of government to reduce obstacles so that we can provide the best care to our patients. And that has ranged from working to secure PPE, personal protective equipment for frontline workers, again, not just physicians. And by the way, frontline workers include those who are cleaning our buildings and driving us, those of us who still needed to work to and from. And now we see our teachers and all of our educators needing to go back to school. And I'm sad to say we still don't have all the PPE that we need, but we've been working and advocating for that since the very beginning. Reiterating the need for widespread testing, both diagnostic and antibody and rapid test, as states and other businesses, our commerce continues to reopen. And again, this work certainly has ramifications for physicians, but really physicians get up every day, and other healthcare colleagues, nursing colleagues, respiratory therapists, we get up every day with the goal of taking care of our patients. And so we need to continue, and we will at the AMA do this work and partner with everyone to make sure that people have the equipment that they need. Next slide. So the AMA, we understand that, again, this is a global pandemic. We do not exist in a bubble, either individually or our homes or in this country. We must all work together to make progress. We have made numerous resources available on the World Medical Association website. The AMA is a member of the World Medical Association. That's a great opportunity for us. It's been, as a president, we have 3 positions: president-elect, president, and immediate past. And those 3 positions represent the AMA at World Medical. I've had the pleasure of attending those meetings, talking with my colleagues around issues that affect us all. And it really does bring home that we are a global society. Just a quick aside, the incoming president of the WMA is Dr. David Barb. He's a former AMA president. He's from Missouri, family medicine physician from Missouri. And he will be inaugurated as the next president of the World Medical Association at the end of October. And the focus of his presidential year will be COVID and its impact on patients with chronic disease. Next slide. Because COVID-19 is affecting the entire world, we believe that the administration's decision to withdraw from the World Health Organization was ill-advised and foolhardy. Withdrawing from the WHO, we believe, is a major setback to science, public health, and the global coordination efforts needed to defeat COVID-19. Withdrawal also leaves the U.S. without a seat at the table at a time when our leadership is most needed. So the AMA joined with other physicians organizations, the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Physicians, in calling on Congress to reject the withdrawal. We need to make sure that we make every effort to preserve the United States relationship with the World Health Organization. Next slide. So we know that COVID-19 will have has had far-reaching consequences in the way that we deliver care in the U.S. and throughout the world. COVID has certainly highlighted some of the fault lines of the current health system, many, of course, that have been generations in the making, and many which some of us were already worried about. But again, it also offers us the opportunity to do better in the future. And so I'd like to focus on 4 areas through which COVID-19 will change healthcare, hopefully for the better. But I will say that all of us will have to make sure we are continuously engaged to make sure that it is for the better. Again, even though times are difficult right now. So those 4 are health equity, mental health care, coordination, and the public health infrastructure, and a greater use of technology. Next slide. Next slide, please. So COVID-19 is a current backdrop against which we can see the results of centuries of inequities against Black and Brown communities here in the US and throughout the world. These inequalities are studied, they have been documented, and they are a large part of why marginalized communities face disproportionately higher rates of chronic illness. Next slide. In the US, communities of color have been hit especially hard by COVID-19. In July, a New York Times analysis of data from the CDC found that Blacks and Latinos are 3 times as likely to be infected as whites and nearly twice as likely to die from the illness. And that is one of the many reasons that the AMA early on in this pandemic called upon the US Department of Health and Human Services, as well as state and local health departments and institutions, to standardize, collect, and make publicly available all existing race and ethnicity data. We also need zip code data. We also need data by gender. But particularly, we wanted to make sure we had the data by race and ethnicity, since again, those communities were early on hit hard by COVID. Next slide. So I like this slide because it forces us to take a step back, right, and look at a 30,000-foot view and ask the question, what creates health? You know, at the AMA, we are looking at historical and current inequities through the lens of all of the determinants of health, the social determinants of health and the structural determinants of health. Including from this slide, you see the many opportunities, I would say, for a health promotion, but you can also see the many opportunities for health inequalities if left unaddressed, and if we don't think about a more coordinated partnership and an all-of-nation approach here, because we know that factors beyond the exam room impact health: poverty, educational attainment, lack of employment opportunities, job and housing insecurity, access to fresh food, nutritious food, public transportation, discriminatory policies, just to name a few. Now this slide actually shows the many drivers, again, or determinants of health. But again, it also, I hope, highlights the many opportunities that stakeholders have to create better health outcomes for our entire nation. Next slide. Now, the AMA is very committed to the work around health equity. We created in 2019 our Center for Health Equity, and our goal is to embed into the DNA of our organization work on health equity. Because for too long, the responsibility and the burden has been on a few, perhaps the diversity, equity, and inclusion officer of an organization, or a task force on gender equity, or an LGBTQ task force. But the burden has been on that person, that task force, that committee, and has not been assumed by the entire organization. And so we need to invert that burden. And that's what we aim to do through the leadership of our Center for Health Equity. We want to voice and model what organizations can do to address these issues. Next slide. And so the COVID, certainly pandemic, has impacted the mental health of our community. We know that through surveys from the CDC, the Kaiser Family Foundation, that adults and children across this country are reporting depressed mood, anxiety, feeling stress, sleep disruption, appetite disruption. We know that those perhaps who are younger, communities of color, our essential workers, unpaid adult caregivers, particularly are reporting disproportionately worse mental health symptoms. We've seen reports of increased overdoses and some increased thoughts of suicide. Now, just recall, these are reports. We won't know the true impact of this until we collect the data throughout this pandemic. And we also don't want to note a cause and effect relationship, but clearly in a time of uncertainty, these symptoms do rise. And so what we need to do is work to make sure that we have the infrastructure and the services and supports needed now. Because I can tell you, I'll probably make this point again, that we entered COVID on a foundation, again, of health inequities, but we entered COVID on a foundation, a lack of access to mental health care, and a very precarious infrastructure for the provision of mental health services. Next slide. Another key area for us to think about and prepare and plan, again, is looking at the impact and understanding the impact of adverse childhood experiences as we think about the children. This was a landmark study here, this ACEs study. Many of you have probably already heard about the ACEs study, CDC and Kaiser. And for children in the US and beyond, we learned that experience of physical, emotional, or sexual abuse in this study, and substance use in parents, violence, intimate partner violence, economic insecurity, these stressors, these traumatic events are linked to serious problems later in life. risky health behaviors, chronic health conditions. Let me linger for a moment on that because some folks might even intuitively think, well, sure, mental health disorders are going to be a complication of adverse childhood experiences, but think about this now. Again, chronic health conditions also are related: diabetes, heart disease, lower life expectancy, early death. And so we need to make sure that we not only know about this study, but we move forward with action on this study to make sure that all of our systems are trauma informed and we have the necessary services to address trauma. Next slide. Again, I've talked earlier about children in this pandemic. Of course, schools were suddenly closed early on, and they're opening slowly, but we've had online learning, and that has been a struggle because routines have been disrupted for children. They've been unable to play with their friends. They've been unable to participate in some of their activities. And some of them, of course, and all of us actually worry about the seniors. This slide is about children, but more isolation. And again, for some, economic stressors. And so we know that all of these impact mental health on everyone, and particularly our children. Now, I am not one of those that are predicting necessarily a tsunami, but I think, again, at this time, we should be planning and preparing and making sure we have systems and supports in place for our children. And we will have to do and provide those in different ways. But, you know, we innovate in this country, and so we should be thinking about those things now. Next slide. It is important as we move through and understand mental health, and that's why I'm so glad to speak to Rotary this morning. I like to speak to other business groups because I think for far too long, the thinking has been, we'll let the healthcare stakeholders fix healthcare, hospitals and doctors and nurses, and we'll let you guys do it. And maybe the business community, you know, certainly thought about these things when they were purchasing health for their employees. But I hope that through well, I've made a concerted effort during my presidency or my time in leadership at the AMA to talk to business leaders, talk to community leaders like you at Rotary. Of course, you already have a track record of health, right, and working to eradicate polio, and that's great because you can model the importance of becoming engaged and involved in healthcare. Again, it is an all-in proposition, and that is whether or not we have a pandemic, epidemic, serious outbreaks or not. And so we need to make sure that mental health is destigmatized and that it's integrated and that there's parity. Those of you who are employers and you provide health insurance for your employees, I urge you to make sure that mental health services are just as easily accessed as other services. You know, you want to support your folks having their diabetes and high blood pressure managed, and you want to support your employees having their depression and anxiety managed. Next slide. So again, in addition to highlighting health inequities and the need for a more robust mental health treatment and prevention system and infrastructure, the COVID-19 pandemic has highlighted our years-long inadequate funding of the public health infrastructure. And that includes agencies like our premier agency, the Center for Disease Control and the FDA. You know, certainly we can have a fair-minded debate of some of the issues that are happening right now. But again, taking a longer view and looking at these institutions, they need to be well-resourced and well-funded, of course. And I'll just say it to state the obvious, there needs to be no political interference in our agencies whose sole mission is to promote science in this country. But they also need, in order to do great work, adequate funding. And so we really do need to make sure that we work on that going forward. Next slide, please. Less than 3% of the $3.6 trillion the U.S. spends is directed toward public health. And so we really need to look at that and make sure we have adequate preparedness programs, adequate programs for chronic disease, adequate programs to do the research on issues such as gun safety. We need to make, I can tell you as a physician, I want and my patients expect me to have all the information at my disposal or as much as I can. I've never met a patient who wanted me to have less information. And so we need, though, to make sure that information is evidence-based and science-based. And that research requires funding. Next slide. The AMA has been a long supporter of public health. As I've traveled across the country, sometimes people are surprised about that, but long-standing regarding seatbelts and smoking and universal access for the essential public health services and sufficient funding. What you see on this screen is policy passed by our AMA House of Delegates, and just quickly, our AMA House of Delegates as representatives from every state and every specialty, and the women's physicians, senior physician section, medical students come together twice a year normally and debate. We have fair-minded, science-based debates, and then we vote, very democratic organization, vote on policy. I actually think that's one of the many reasons that AMA policy is so respected, because it is representatives from physician groups and specialties and practices and ages coming together to develop policy. And then that policy, of course, we advocate for that policy, both the federal level, and we work with our state partners, such as the Medical Association of Georgia and other state medical associations to, of course, to enact policy, again, with the goal in mind of serving our patients and giving the best care, evidence-based care to our patients. Next slide. So looking ahead, so as I said, the COVID-19 pandemic has exposed significant fault lines in our system, not just our healthcare system, but again, healthcare, transportation, safe streets, whether or not you are zoning for sidewalks, zoning for grocery stores. All of these are very important, but unfortunately, we are seeing some fault lines here. I mean, even thinking about the school, I think all of us know now that we have relied on our school systems for a lot: mental health care, nutritious meals. And so certainly it's inappropriate, but we have to make sure that we are giving our school systems the resources that they need for all the work that they do. You know, we have to get beyond being reactive, right? We typically, all of us react in the moment of crisis. But pandemic response, our healthcare delivery, preparing for future public health needs, the opioid crisis, I've been chair of the AMA's opioid task force. We cannot put off the inevitable investments needed to make sure we are a nation that is prepared to meet the healthcare needs right now and in the future. Next slide. So hopefully that's a lesson learned during the pandemic, and we will continue to learn more lessons. Certainly hopefully everyone has seen the absolute critical need for coordination across federal and state governments, streamlining our responses, looking at logistics, looking at just-in-time supply chain. We need to make sure that someone is looking at these issues permanently. There are permanent roles that are adequately funded. We clearly see that we need to improve our diagnostic testing infrastructure. We need to look at our infrastructure around vaccine and therapeutic development and make sure that it's always guided by science and the evidence, and the timelines are dictated by science. We have to look at our federal and state stockpiles and making sure that there are nationally coordinated systems for acquisition and distribution of these medically necessary supplies. We've seen sort of our 50 states and additional territories in competition with one another, and that actually cannot be the status quo moving forward. And we really have to make sure we have a comprehensive, well-coordinated data system that collects all of the data, including data regarding race and ethnicity, so that we can know how to better target our interventions and our resources. Next slide, please. So notably, again, there have been some opportunities to learn during the response to this pandemic. Certainly, technology, and it's, we've seen this morning, does not always work smoothly. And so, as we think about moving forward with technology, let's make sure we don't forget those who don't have broadband access, and we're thinking about using technology. And I've been using telepsychiatry for many years. But not every patient has an iPhone, not every patient has a computer, not every patient has a data plan. And if they wanted to pay for a data plan, not every patient has access to broadband in their communities. We have to think about, and I think about this a lot, privacy. If I'm seeing a patient, and I think the technology and the ability to use the technology is great, but as a psychiatrist, people talk to me about issues that they don't talk to anyone else about, and not always able to have those private spaces at home. So we certainly know that there's been an acceleration of the use of technology. In 2016, only 14% of physicians were doing virtual visits. 2019, that doubled, and that in number has exploded since the beginning of the pandemic. And the AMA has advocated forcefully for telehealth and mitigating some of the rules and regs that prevented that. And certainly we're happy that CMS eliminated some of those regulations. And so this will be a path forward, not, again, a one-size-fits-all path. Some people like it, some people don't prefer it. At least I'm speaking from my personal experience with some of my patients. And so what we will need to do is make sure we have thoughtful, evidence-based conversations on the other side of this pandemic to continue what works, but to stop what doesn't work. And the AMA is committed to continuing to bring the physician perspective as part of the conversation to remove burdensome regulations, provide best practices for data protection, patient privacy and confidentiality, and address any ethical questions, by the way, that will emerge when a physician cannot be physically present with his or her patient. Next slide. So COVID-19 poses a crisis, to state the obvious, unlike the world has seen in a generation, but it also presents the opportunity to create a more equitable, efficient, more appropriately financed healthcare system in the future if we will only take a moment to learn the lessons and then put those learning opportunities into action. So thank you for your attention this morning, and I believe that I can take some questions.